Hi YouTube, so I'm here today to talk about C-section deliveries. Yay! Not really yay, but I thought that would just brighten up the mood a little. Uh so I always get told by like everybody that I know that's pregnant tells me that they want a C-section. They would rather be in no pain instead of in a lot of pain from labor. But they don't think about the stuff like, okay, well, after the incision is made, after the baby's out, after your spinal wears off, oh, buddy, you're in a lot of pain. I cannot tell you how bad that hurts. Well, I could, but you won't understand how I felt. You can't sit up, you can't stand up, you can't cough, you can't laugh, you can't sneeze. It hurts way too badly. And after you have a C-section, at the hospital I was in, the two nurses had to help me get out of bed after they took the catheter out. Oh yeah, that's another lovely little device, is the catheter. After they took the catheter out, they told me that if I had to go to the bathroom, they had to help me to go, like, get up and go in there. Okay, whatever. I called them and told them I had to go to the bathroom. They helped me up. They, like, both of them had to get on either side of me and help me up, walk me to the bathroom, and they're just standing in there. Come on, I can't go to the bathroom with other people in there, especially two women. That's just weird. But anyway, so a lot of people think that having a C-section is better off than having a natural birth. But a C-section takes a lot longer to recover from. My son is 15 months and I still get like stabbing pains. Yes, that's normal. And so I'm still healing from it. Some people it takes years to heal from. It is a major surgery. So unless you absolutely need a C-section, like it's an emergency, the baby won't come out, the baby's heart rate is almost non-existent, any major problems like that, then obviously you need a C-section. But if you just don't want a vaginal birth because you're afraid that labor is gonna hurt, C-sections hurt so much more. So just deal with the pain for a couple hours to a couple days, however long it takes. My son was in the NICU for a week. I could not get up to see him for the first couple of days. They couldn't bring him to see me. And when I wanted to go see him, I had to call the nurse, bring me a wheelchair, get in the wheelchair, wheel myself down, and then they told me the second or third day that they wanted me to get up and walk around. Hell no! You know how bad that hurts to stand up? And it feels like your insides are just gonna come out. It feels so disgusting. And when you're having a C-section, you can feel weird stuff. You can't feel pain, but I could feel the doctor's hands inside me. And it was so disgusting. I can't even explain how gross it felt. But, so, the worst that's gonna happen, with a vaginal delivery, a normal vaginal delivery, if I can talk, is an episiotomy. Unless you've got complications, that's the worst that's gonna happen. Okay, it hurts very badly, as I've been told, but nothing hurts more than a C-section when it comes to birth. I know somebody who told me that her C-section her recovery was great, she didn't feel that much pain, but she's 1 in a million. Well, maybe not a million, but I was able to get up about 4 days, I think, like without problems, without anybody needing to help me, 4 or 5 days after I had my son. And I would walk around a lot after that because they say that walking will help recovery faster. But I mean, when I got home, I couldn't lay down like flat on my bed like I used to until I think 3 weeks or 4 weeks after. And so imagine having a C-section and then having to get up at night to feed your baby, to change your baby, to make sure make sure he's going to go back to sleep, you know. I was lucky in the fact that my boyfriend, my baby's father, was nice enough to get up and change our son's diaper, or diapers, I should say. And I would nurse him, and my boyfriend would put him back in the crib when he was done. I could not stand up without it hurting. So just think about this stuff. I'm not trying to scare you in any way, shape, or form. It's so much faster. Recovery is faster if you have a vaginal delivery. And with a C-section, a lot of people say once you have a C-section, that's all you'll have is C-sections. But that's only because doctors will not, gladly help with a vaginal birth after a C-section and VBAC. You can find some that will help you, but it's hard to find one. So just know that. Yeah. C-sections, they suck. And it's not just bad, slow recovery for you, the mother. It's also really hard on the baby. A lot of people don't understand that it hurts all this stuff, like vaginal birth hurts a baby, yes. But a vaginal birth is actually good for the baby because when the baby goes through the birth canal, they get bacteria up their nose, everywhere, in their eyes. Yes, that sounds gross, but they get bacteria that helps build their immune system that babies via C-section don't get. And my son, when he was 4 months old, we went to the hospital, the emergency room. He had a real high fever for about 4 days. It was 105 degrees and going up. We had to give him baby Tylenol and stuff just to keep the fever down. He wouldn't eat. He wouldn't drink anything. So we took him to the emergency room. He had this rash everywhere. He was swollen. They kept him there for, I think, about 4 days. They didn't know what it was. They could not tell me. And I don't know if that's just because his immune system is not as good as it could be. And I'm not sure if that's because I had a C-section or not. But that is my thinking on what happened. He looked like he had scarlet fever. They tested for it. It wasn't scarlet fever. And I was reading something about Kawasaki disease, and it originated in Japan, but we do have cases of it over here in the U.S., but it is very, very rare. So I'm not sure if that's what he got. That's what he had or not. But so those are my views on a C-section, and not just my views, but a lot of women's views. So you just have to outweigh the benefits to the negative, longer recovery time, complications with the baby, very, very bad pain, you can't walk, all that stuff, versus a vaginal delivery, I should say. It only takes about a couple days to a week or two, I think. That's what I was told. To recover. And the baby usually has no complications. I don't know. I am going to try for a VBAC next time. Well, not try. I'm going to have one. Have to be positive here. I'm sorry that this video is so long. Wow, I say a lot, don't I? I think because I can't think of what to say right on the spot, but whatever. I don't care if you don't care, whatever. There you go again. Yeah, my battery is about to die, so I think I'm gonna cut this video now while it's 10 minutes long. So thanks for watching. Do not forget to, excuse me, I burped. Don't forget to like, comment, and subscribe. Any negative comments will be deleted. I'm just letting you know. Thank you.